Another observation about high cost. My colleagues at the legislature just don't understand this, that you don't reduce costs by subsidizing something. You can shift the cost, you can divide the cost, you can hide the cost, but if we're worried about the total bubble that society is, how much of the pie society is spending on healthcare, we don't make it any less by pouring taxpayer money into it. We just lessen the burden on the particular person who's getting the care, but we make other people pay for it. That doesn't reduce costs, that just spares someone some of the costs while it shifts it elsewhere. Another point about those costs, and related, that you can't reduce costs by subsidizing, it goes to Linda's argument that who cares how much of the GDP we spend on healthcare. I would say it a little bit differently, which is healthcare dollars are not fungible. Dolly Parton's boobs are not transferable to prenatal care for pregnant women. She spends the money where she wants to spend it, and if she didn't, it wouldn't magically appear somewhere else in the healthcare system. If you want me to state that less provocatively, a hip replacement for a middle-aged weekend warrior athlete who skis, he pays the cost of health insurance that covers that, and it gets provided. If he didn't do that, it wouldn't magically become vaccines or basic care in the community or more resources at the community health center. Those services, those transactions exist because someone wants them, someone has the wealth to pay for them, and someone has the desire to provide the services that the guy wants. And we aren't going to improve the healthcare situation of the poor by trying to corral and rein in and limit the healthcare situation of the more affluent. Anything else I wanted to say about that? Well, that all sounds like common sense to this audience. By the way, I forgot to mention one other evidence of the extraordinary prowess of our American healthcare system. Andy McElhaney is still alive, and in any other country, that might not be the case. Senator McElhaney, good to see you.
It's nice to see you. There's some debate of whether I'm alive or not.
Well, don't try and remedy it over the internet. It won't work. Linda just told us. So, friends, I'm not going to try and give you a catalog of all the bills going through this session on healthcare. I'm going to pick 2 or 3 as illustrative of the tug of war we have. I'm going to pick one bill that I think goes in the right direction, although Linda will probably smack me and tell me no, because no bills go in the right direction where Linda Gorman is concerned. And then I'm going to pick 2 bills that go in the wrong direction. Number one, given the current majority, nothing that does anything very helpful in healthcare has a chance in the state legislature. We're into redistributing, we're into regulating, we're into subsidizing, but we're not into creating any dynamics where freedom and choice can actually put downward pressure on costs. But we're tiptoeing in that direction. A few years ago, then Senator Mark Hillman sponsored a bill that gave insurance companies some pricing flexibility in the small group market. It allowed them to give up to if I remember right, up to a 15% discount for healthy small group employers and up to a 10% price increase for high-cost small group employers.
25%. 25 down.
25 down? Oh, a 25% discount.
25% discount, 10% up, 67% variance.
Thanks for correcting me. You folks that know those numbers, I'm guessing you were opponents of that bill rather than supporters of it.
I was there, helped write it.
Oh, good. Okay, then you're a supporter of it. Because there are other people that just find it a moral affront to all that is decent to think that some people should have to pay a little bit more for health insurance than other people that might pay a little bit less. Motivated by that idealism without any appreciation of real-world consequences. And the real-world consequences are this. When you can offer discounts to small groups, you provide an incentive and a more attractive opportunity for them to either stay in the market or rejoin the market, and you build the solvency of the whole pool. You bring more, through freedom and through market mechanisms, you bring more resources into the small group health insurance pool that covers everyone. When you forbid that flexibility and make everyone pay the same, you impose higher costs on healthy employers who are struggling to keep up with it and decide they can't afford it anymore. They bail out, leaving only the higher demand, and I shouldn't say only higher because this is all incremental stuff, but the percentage shifts are that your healthier but perhaps economically struggling groups decide this ain't a good deal, they bail out, they leave in the adversely selected groups that have higher demand and costs go up. Mark Hillman's flexibility was a huge success. The small group market was reviving in Colorado. along comes a new majority in town and repeals his bill, locks everyone into one size fits all, and the notices start going out from the insurers to the employers, we're raising your rates, and that sucks. But last year, I sponsored a modest tiptoe back in the other direction. It's not based on health results or health claims, but it is based on at least some helpful activity. It allows insurance companies to offer discounts for employee wellness programs. If employers will create and craft a wellness program and encourage their employees to participate, then we'll allow the insurance companies to offer a discount to those employees, to the companies that create those wellness programs. This year, we're trying to go a step further and say, not only can you offer a discount for the mere existence of wellness programs, but you can offer a deeper discount if they meet participation goals, if they actually get their employees to participate and do it and start meeting performance goals. Once again, the consumer advocates are coming out of the woodwork. A moral outrage, you're trying to charge some people more or less for health insurance. What about sick people? They can't participate in wellness programs. What about disabled people? They can't participate in wellness programs. Nonsense! They can. The wellness programs can be crafted appropriately to the participants. If you're in a wheelchair, the wellness program could involve a stroll around the block, a roll around the block every day. Whatever the factors are, they can be tailored to the abilities and the health levels of your employees, and the insurance companies can say, yeah, we'll offer a discount for that kind of activity. That bill is struggling and fighting, but it's passed the House now, actually, I think on third reading. Passed the House, it's coming over to the Senate. I'm the Senate sponsor. I want that bill to pass. In this partisan environment, I'm not sure if its best opportunity will have my name on it. So I may get off the bill and see if I can find a Democrat in the Senate that will sponsor it. And I'll be cheering for it, but I may take my name off it.
What's the number on it?
I think I'm sorry, Elaine, I'll have to call you. I don't remember. I don't do numbers. I went to law school, not medical school. Now, an example of two bills that went the wrong direction, or that are going the wrong direction, again, motivated by compassion, by the best of intentions. Senator Foster has a bill to mandate that all individual policies, unless it's just limited to individual, include maternity coverage. Not only do they include maternity coverage, but that they can't define pregnancy as a pre-existing condition. So you can, in the 9th month of pregnancy, call an insurance company, demand coverage, and get by the policy and not get excluded. Now, what compassionate, warm-thinking person wouldn't think that that's in line with policy? Insurance is a good thing. Professionally attended delivery is a good thing. Let's get the care that women and babies need. Just oblivious, of course, to the incentives and the consequences of allowing people to stay out of the pool and not pay into it, and then step in at the last minute and get coverage, and then put that on everyone else who's been paying all along and drive up the cost of insurance for everyone that was already buying insurance. Not to mention the problem of young men, your young invincibles, who aren't even buying the policies that are available now. Heck, if they're likely to come back to the market when the policies now include the additional cost of maternity coverage. One of the very positive developments in our healthcare market is trying to expand the mechanisms and find more efficient venues than traditional full-service hospitals. So we have specialty hospitals, we have retail-based clinics, we have other ways of trying to make care more accessible, more convenient, and more affordable to people. But the empire doesn't like these encroachments on its turf. So a bill that just passed through the Health Committee right now, sponsored by, how do you argue against a bill brought by the Academy of Pediatricians? The Academy of Pediatricians brought a bill on the laudable subject of continuity of health care. What it really is an attack on retail clinics. And what they want is that when anyone is seen in a retail clinic, the provider at the clinic, the caregiver at the clinic, has to figure out who the primary care physician is, has to establish communication with the primary care physician, has to provide the medical records over to the primary care physician. It limits the age of children that can be seen in the primary care clinic, in the retail-based clinic. I'm not remembering all the details, but the dynamic is this: innovation, reform, less formality, traditional delivery systems resisting, fighting back, trying to outlaw it. So while we're all struggling about how to make healthcare more accessible and more affordable, the participants in the status quo are coming in and pushing back and saying, no, can't do it, it's not safe, or continuity of care in a medical home and ongoing communication is so wonderful that the state has to mandate it. And so this tug of war, while we're trying to reform, they're trying to, a rearguard action to defend the status quo. That plays out over and over and over in the state legislature, and I have rambled at you enough, and I want